Hi guys. So this is my update on I guess my pregnancy, and we have had a nip test taken when I was 11 weeks, and that test came back showing that we had a positive screening for Trisomy 18. It says it had a high probability. It said it's greater than 99 out of 100, so 99%. Yeah, and that it is genetic counseling and additional testing is required. When I got this test done, or when I got this result back, I was trying not to get too stressed out about it, because I read that a lot of the times these tests can be wrong, and it doesn't mean that your child is having, whatever that tested for positive. It's just a screening, it's not a diagnosis. But just a number saying 99 out of 100, the chances are 99 out of 100. It's pretty scary, I would say. Oh, hold on 1 second. So we were told we're gonna get, this is news I got from my midwife, and she said she's gonna send a referral to a high-risk pregnancy or high-risk fetal monitoring clinic, I guess. They're gonna send me there, and that we're gonna have ultrasounds taken, and yeah, that we're gonna probably have a CVS or a amnio fluid test. The one where they poke a needle into your stomach and take a sample of the amnio fluid in your stomach. So I had to wait 2 days for that. In that time I did obviously a bunch of research on what Trisomy 18 is, and for me important was to know, what does this result of the test mean? Does that mean there's a 99% chance that this baby has it? Does it mean there is a 99% chance that they found something? What does it mean? So I'm still not 100% sure if that's what it means, but my husband's mother, she works for a company. They do those tests, and she had she had some connections, I guess. She was getting in contact with a genetic counselor, and she asked if she can answer a couple of our questions, and I was really appreciated for that, because that gave me a little bit of ease. She told us that she took all of our informations. I'm not exactly sure what information she put in, but all the information she had were from those test results. I sent her a picture of those test results, and it had my age on it. It had how many weeks I was pregnant, then obviously what the test said. Yeah, put that into some kind of test, and that showed for us there was a 46% chance that the baby would have Trisomy 18. That made me feel a little better, because 54% is better than a 1% chance. Nonetheless, we 2 days later we went to the risk pregnancy clinic and had ultrasounds taken. I was really positive until then, Jeff was as well, I think. I mean, Jeff is always like very level-headed, as best as he can, I guess. But we had those tests taken, and we had the ultrasound taken, and you know, the ultrasound technician, they never really like tell you anything, like if there's something wrong or so. She said like the doctor would go over everything. I just remember she said it measures normal for my due date. That's all she said. And she said it has a strong heartbeat, 164. It's a girl. I mean, we know it's a girl. So yeah, then we had to go wait for the doctor. We had to wait a very long time, but we weren't really like super anxious or nervous. We were just like, we're just gonna wait what they're gonna say. As far as I knew, is like, even if you get like good ultrasounds, they don't really mean that there's no risk anymore, because you can't really always see something on the ultrasound. You really just have to have a you know, either a CVS or an amnio fluid test done. So we go in this room, and there was like a doctor, and there was the I think she was a genetic counselor and a medical student, and a nurse who took my blood pressure and my temperature, and then she left the room. So then they started with, how much do we know? And we were a little, we had some information, I would say, and so we told them everything we know, and then they let us talk, and then they say like, yeah, the ultrasounds don't look good. He found shadows. They indicate liquid in the brain. I think that's how he said it. I think this is how I remember it. It is like, you know, like when you like hear something bad and you kind of go into a shock, I guess. He said there was something with the spine, and that he saw like some clenched fingers. Like if the test already says it's like looks bad, then the ultrasound shows something not normal, then yeah, I was like, I asked the doctor even, I was like, so, you know, combining those things we have right now, what the chances are, and he was like, nah, they're not good. So I mean, if the doctors tell you that, yeah. So they asked if we want to do the CVS that day, or they said we can do the CVS if we want to do it. We were like, yes, we want to do it. They were like, yeah, you can either make it today, or we can see if we can do it today, or you can do it tomorrow, or whenever you know, if you need a little time. I was like, no, I want to do it as fast as possible. They were like, yeah, we should get it like done relatively quickly. I was just like, okay, like getting myself into the mood. Okay, my baby has trisomy 18. Then they had us in a room waiting to get a room ready for the CVS. And the CVS is where they take a sample of the placenta. I heard it does not hurt, or it doesn't hurt much. It's just more like uncomfortable, but it hurt for me. Like it was, he said he gives me some, it still hurts now. Like it's been 2 days, and I mean the where they punctured it is still like really sore. Anyway, he said I was like, is it gonna hurt? And he's like, yes. So I was like, okay. So yeah, so he's gives me a shot to numb this area. He cleans it first. Put some paper up here, and up to, like one of those pads. I was just laying there, like he told me to put my hands behind my back, but I had my hands like there. After a while, the nurse was, or the ultrasound technician was here holding the ultrasound here, and he told her how to hold it so he could see the baby and where he needs to go, and he was poking it a little bit, seeing how the baby would move when he poked, and like he poked with his finger. yeah, and then he cleaned it. He gave me a shot to numb it. Didn't really feel that numb, but he put the needle in, and maybe it was just like a psychological thing, because I remember after it was done, I was just like starting to cry. Like that was the first time I was really starting to cry, and maybe it was like the pain and all the stress from all those news and everything combined. But yeah, it was like he put the needle in, and it's like, this is an area when you're pregnant, you kind of like, you know, you feel there's something going on, and you want to protect this area, and then like there's somebody poking a needle in it. And yeah, I really felt like, honestly, okay, let's say like that. It was like a shot, like when you get a normal shot when somebody puts a needle in, but then he poked through 2 or 3 layers. I don't know what kind of layer, maybe muscles or whatever, but that was, I remember me always like, you know, being like that. And then he actually then he had to take the needle back out and do it again, because he couldn't get a good angle or whatever. So, but then he finally had a good angle, got the placenta, and then he said like, now don't move. And I was, the whole time I was like trying to breathe really flat, so I wouldn't move my body a lot. And he took the sample out. It looked a lot, but it was like there was some liquid in the syringe or whatever. He like pulled it out, and so it was pink. It was a pink colored liquid. But she told me that is like the whatever the solution that's already in there. Jeff was rubbing my head, and I was like, just don't touch me. I was always afraid that, you know, I wiggle and like, I don't know. And I saw the baby moving. Like, I was like, just hold still. Yeah. So then he sucks a little bit. That hurt a little bit. Like him pulling it out, and then he took the needle out. That was fine. Like I said, after that I started crying, but then everything was pretty much done. I mean, she said we can stay here a little bit and I can calm down. I was like, no, I just want to get out of here. And yeah, I was like, probably looked really miserable walking out of there. And this is 2 days after. I can show you my belly. I don't know if you can still see it. It's, sorry, here and here. And like I said, the whole, like the first day after was, they told me to, I didn't have to be on bed rest, but I should be kind of like a, you know, take it easy, be like a couch potato. And I was like taking a nap for 4 hours, and then the day was pretty much over. And yesterday I was very sore on my whole body. Like, I don't know what it is, but my back, everything just feels so tense and tight. And yeah, today's Friday. They said we probably gonna get the results on Friday, but it's like noon now and they haven't called yet. It's 1 o'clock. They haven't called yet. So they said it's Friday or Monday, so I'm guessing it's probably not gonna be Monday. But also, I really don't have much hope anymore, because it's just, you know, it's 2 out of 2 so far said they don't show good results. And I know the only really like 100, like 99.9% of chance of really telling me is gonna be the amnio fluid procedure, and we decided to do that anyway. So regardless of the result of the CVS, we're gonna have that tested, but that has to wait until I'm 16 weeks. Yeah. So I hope that was a little bit give everybody a little bit of information about our situation right now. Also, if you are going through this, I don't know, I like to hear other people's stories about it, just to, I don't know, get prepared and just maybe get some more information. So yeah, I hope this was helpful, and whatever it is you're going through right now, I wish you the best of luck and good nerves, and just stay calm, and yeah, it will be okay, I guess. I don't know, I just, like, people be like, I don't know what to tell you. I don't know what I would tell myself either. It's just like a really bad situation. But I always try to remember myself, there's people out there that have it worse, and yeah, you know, just try to stay positive, but be realistic on the other hand. Okay, thank you for watching. See you later. Bye bye.